Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. These are some of the stories we're tracking, the highlights this hour. Adamawa State government prioritizes rural communities in the COVID-19 fight. Indigenous solution to coronavirus as Benue government manufactures automated disinfection tunnel. And the global death toll exceeds 900,000, raising fears among nations. More than 900,000 deaths around the world have been linked to the coronavirus, according to Johns Hopkins University Resource Center. Latin America and the Caribbean are the worst hit region, accounting for 340 deaths, followed by Europe with over 200,000 fatalities. Latest figures from the Nigeria Center for Disease Control, NCDC, shows that the Federal Capital Territory, FCT, topped the list of daily COVID-19 cases with 40 new infections. A total of 176 cases were confirmed in 16 states and 3 deaths were recorded in Nigeria. You see a breakdown of some of the states of the 17 that recorded cases last night. Second is Lagos. You have Plateau in third place, Enugu there as well. Delta is also on the list, and you have states like Osun and Bauchi recording 1 cases each, also for Edo State. Till date, the total figures now at 55,632. 43,610 cases have been discharged, and we have the death toll at 1,070, all recorded in the 36 states of the Federation and the FCT. According to the Africa Center for Disease Control and Prevention, the COVID-19 virus can be transmitted in areas with hot and humid climates. It can be transmitted in all areas, including the hot and humid weather. This is as the continent records over 1.3 million cases and the death toll over 31,000. As part of efforts aimed at mitigating community spread of COVID-19 and other diseases, the Adamawa State government has commenced the recruitment of over 1,000 technical health workers in the state. The recruitment exercise, according to the chairman of the Adamawa State Primary Healthcare Development Agency, has become necessary because of the need to provide health care to the doorsteps of the people, as well as prevent community spread of COVID-19.
Call it a major strategic move aimed at curbing the spread of COVID-19, and you may not be wrong. The idea of healthcare delivery to the ordinary people at the rural communities is a big priority for the Adamawa State government, and it says it's determined to make this work. As a first step, the state is recruiting thousands of healthcare workers to fill in the existing positions in the rural areas where community transmission of COVID-19 has become a big threat.
Obviously, there are evidence of community transmission. We have cases which we cannot identify their source or how they contracted the infection. So at community level here, because of our spread, our reach, and in view of the existing structure or the platform that we have at communities, in every of our facility, we have a facility management within the facility comprising of technical health workers, and they interface with the community.
At the headquarters of the Adamawa State Primary Healthcare Development Agency in Yola, the state capital, hundreds of healthcare workers turn out for the recruitment exercise. The senior special assistant to the Adamawa State Governor on Primary Healthcare Services says it's a strategy towards increasing the availability of the workforce in health facilities across the state.
Most of our staffs in the past have been ad hoc staffs of either one NGO or the other. So now these are the time that these people are winding down the services. And you can see that we're in a global COVID pandemic where our health system are being challenged. So now we're in a situation that we need to own up to our responsibilities. We have over 1,000 primary healthcare services. But right now we have just about 403 who are working within the states. And we're trying to break them down to 226. We're prioritizing quality against quantity.
A community leader in an area affected by insurgency describes the recruitment as a good development.
The governor and his team are doing well in controlling the COVID-19 spread. And by employing these workers also, it will go a long way.
According to the chairman of the Adamawa State Primary Healthcare Development Agency, the workers will be distributed equally across the 21 local government areas of the state to help in the fight against COVID-19 and take care of other health needs of the people.
And in Yobe State, about 700 Almajere have been sensitized by the government on the coronavirus pandemic and are beneficiaries of the safety protocol materials distributed. This is coming as part of the government through its Sustainable Development Goals SDG agenda across 7 Sangaya Quranic schools in the state. The SDG focal person there, Mr. Musa Damago, who is also a member of the Yobe State's COVID-19 Committee on Prevention and Control, says that some of the general response plans do not target the peculiarities of the Amajere in society, but he believes that this will go a long way in curbing the spread of the pandemic among the pupils.
We decided to launch a special program for the Almajiris and reach about 7 Sangaya schools in the state. And through that, we were able to sensitize them and their school and their teachers, and also supported them with personal protective items like face masks, hand sanitizers, hand washing machines, and all of that.
The Benue State Ministry of Science and Technology has manufactured an automated COVID-19 disinfection tunnel in compliance with the call by Governor Samuel Ortom for Nigerians to take advantage of the pandemic and look inwards for indigenous solutions to help defeat it. The automated disinfection tunnel was exhibited by the Commissioner for Science and Technology at the Government House, and it says that it is a symbolic test run of the tunnel fitted with infrared thermometers for temperature checks, a dispensary point for hand sanitizer, and a 360% turnaround fumigation to clean anyone passing through. Here's more with our correspondent Pius Angro.
Beside the production of alcohol-based hand sanitizer by the Benue State government to combat COVID-19, another milestone today has been achieved with the manufacturing of this disinfection tunnel by the Ministry of Science and Technology. Earlier, during the exhibition, the Commissioner for Science and Technology, Mr. Oiwona, says that this tunnel has features like infrared thermometers to check temperature. It also has alcohol-based hand sanitizer to disinfect you while you do a 360-degree turn and your entire body is disinfected to allow you access into public places. Part of the plan is to deploy this to markets, churches, schools, so that people can use this to disinfect themselves and reduce the incidences of passing coronavirus in the society.
Most of the items we use for this project, they are locally fabricated, locally made. So there is a heavy local content in this material. So it is aimed in taking the battle against COVID-19 to the next level. We've produced sanitizer before. This is an extension of what we have been producing, and this is not going to be the last. So it is something that we are using to fight COVID-19.
Also, to go commercial, I say one of such units costs 3 million. But if you want more than 5 units, the price could drop as low as 2.5 million. And so the state is looking at taking advantage of the COVID-19 period to begin to manufacture this and sell to whoever wants within the local market or international market. And it's also a call by the governor who has asked the ministry to make efforts to begin to market this product so that Nigerians can begin to take advantage of the challenges COVID-19 has posed and proffer solutions to them. From Makodi, the Benue State capital, Pius Angbo for COVID-19 updates.
Thank you, Pius. Now, the leadership of Nigeria's Joint Health Workers Union, JHSWU, has given the federal government till September 13 to address all lingering labour issues with its members or risk a nationwide industrial action. This was after an expanded meeting of the union in Abuja, where the leadership insists that the federal government has been paying lip service to all conciliation agreements entered with the government. We have Mr. JHSWU Belemoye. He's the national chairman of the Joint Health Sector Unions. He joins us from Abuja. Thank you for joining us on the program. I'd like to begin by asking if you could briefly tell us what the demands of the joint health workers are that government has been since paying lip service to.
Thank you, and it's a long time. Thank you for having me once again on channels. Certainly, the demands have been a household issue. Apart from the current one, which is the errors in the COVID-19 hazard allowance payments, which by July 1st, the ministry agreed with us in a meeting, and that they will correct. And we also urged them to correct it before paying the next batch, which is June. But surprisingly, they failed. I think they're only trying to show that a tradition of failing agreements and understandings. So that's one. Then the other is we have 5 major issues. The other is the coins adjustment, which had stayed for 3 years. And if you look at the agreement we signed, it was supposed to have been implemented in 5 weeks. But this is 3 years now, 2017, 30th September precisely, to now. And then we begin to ask why. And again, the worst of it into that is that it also exposed a level of distrust, because all along we were being told that the president, they've taken it to the president said no money, no money. And at the same time, president graciously approved much more than what we were asking for the aviation workers. So when we asked again, oh no, but this all came to the light that it was a deliberate attempt to just deceive us. It was a lie, because when we visited the president after they blocked us for 4 years, and this year, when we visited the president, he gave us the opportunity to meet with him. Certainly, he was not aware, and he made that clear. And it was there the ministry, the Minister of Labour now said they were unable to take it to him at that time, March this year. So you can look at the bias, you can look at the discrimination in treating, issues of demand by the health groups. If it is, and that's why we've been telling the president, please, even in your appointments of ministers, don't let it be housed by just one group. If the minister is a medical doctor, let the minister of state be of the other group, or vice versa. So that the prevention of one group coming to see the president and telling him the issues of the health system. For instance, we had the time to tell Mr. President, all along we've been shouting that, look, the health system is in shambles. Health system is in shambles. Come to our aid. Everybody said we were just crying wolf. Thanks to COVID-19, COVID came, and the naked truth, expressed itself. And we are saying here that there are so much more, and there is so much more that the president needs to know from us if he gives us the time for periodic meetings. And that is a simple reason why the former minister, Adeole, tried all his best to prevent us from seeing Mr. President. And the only one time Mr. President met with us, in fact, the wind blew, and the Cox, private was exposed.
So perhaps we understand that there will be a meeting with the federal government in a few hours now. If you could briefly tell us, because we need to go on a break now, what are your realistic expectations from that meeting?
Yeah, the meeting, as far as we know from that letter, the meeting is not even called as a result of the 15 days ultimatum. So we will get there. They should tell us what we are, because all these issues have been discussed and agreed, most of them. So if we go there, we're expecting that they are going to tell us that we are ready to implement A, B, C before the expiration. If that is done, I think we are good to go, because we have been very patriotic all along. You can see with us all through the COVID period, we never embarked on any strike, but now they are forcing us to do so. Nigerians, bear with us.
All right, thank you so much, Mr. JHSWU Belemoye, the National Chairman of the Joint Health Sector Unions, JHSWU. Thank you for joining us on the program.
Thank you.
Let's go on a quick break. We'll be back with more on the global response to COVID-19. Join us again. Welcome back. Activities have fully resumed at the COVID-19 testing center situated at the National Veterinary Research Institute, VOM, Plateau State, which has been receiving samples across states in the northern part of Nigeria. The Biosafety Level 3 laboratory has the capacity to handle up to 1,000 suspected samples that are processed, analyzed and stored, and also serves as a virus transport medium to other test centers. According to the Executive Director of the Research Institute, over 30,000 samples have been tested at the center since the inception in April. The state has been recording an increase in number of positive cases and affected health workers on the rise.
What we need to do is to have a uniform policy in terms of not just testing sites, having to open up more laboratories across the states, but make sure that those laboratories are testing at full capacity. If, for example, you have a gene expert lab in Bauchi State that has a capacity of 50, and you have a molecular lab in Plateau State that has a testing strength of 1,000. Now, you will not match this. You see, it's going to take Bauchi a whole lot to measure up to whatever Plateau State is doing. So we need to have, as much as we are having the testing sites, we need to also have, the testing strengths being optimized so that we can have much more people tested per day. As it stands now, even the PTF berated the fact that, the volume of samples collecting, the samples that we are collecting on a daily basis is depreciating. Now, with the expansion of the testing sites, we have not been able to up our testing.
So the coronavirus vaccine being developed by Oxford University has been halted temporarily following the discovery of certain side effects on test subjects. We have joining us here in Lagos, Mrs. Oluwatosin Ateologun. She's a clinical pharmacist to tell us more about this. Thank you for joining us on the program.
Thank you for having me.
I want to begin first with the Russian vaccine. After Nigeria received the memoir, there's been a lot of talk about it. But first, the World Health Organization, have they accepted that the Russian vaccine is one that works for COVID-19?
Well, the WHO is concerned about the safety and efficacy because any vaccine, any COVID-19 vaccine that is brought up should be able to be safe and efficient. Fine, it's something the whole world is looking out for because of the global pandemic. But then, safety and efficacy cannot be undermined. It's very important.
We also understand that, Nigeria is taking a closer look at, some of the makeup of that vaccine.
Yeah.
But looking at what the University of Oxford has, encountered at this point, is this normal and does it set back our efforts to getting a vaccine before the end of the year?
Well, I wouldn't say it's a setback because it's normal. It happens with clinical trials. That's the reason why they're there, to actually ascertain how safe it would be in individuals. And at the stage which this particular trial is in, which is the phase 3, this covers a larger population across different countries, across different regions. And the fact that someone actually came down with an illness which they are still trying to identify also helps to put some drive into the other vaccine producing companies into looking also into their own biodata to also check if they've seen things like this or if anything like this has ever come up. During the period of the trials of the vaccine, sometime in April, there were also concerns that were raised concerning this Oxford vaccine with AstraZeneca. Complaints of headache, fever, muscle pain, but those ones were mild. This one actually required hospitalization of the patient, and that's why it's raising some concerns.
We also know that there are over 150 coronavirus vaccines being developed. We know South Africa started one. I think they called it, they're saying they would be in their phase 2 trial of that particular one, enrolling over 2,000 volunteers. What's the latest on that?
Well, they also are still going through the phases of the clinical trials, and I really must applaud what South Africa is doing, because it helps to give an idea of how the vaccine will be accepted by the black race as a whole, by Africa as a whole. We haven't really had any tests being done in Africa. So what South Africa is doing is actually applaudable, and I believe that as time goes on, hopefully before the end of the year, something good will come out of it.
All right. Optimism there we share with you. Thank you so much, Mrs. Oluwatosin.
Thank you for having
clinical
me.
pharmacist. Thank you
you
for coming on the program. A grim milestone in the world, as more than 900,000 people have now died from COVID-19, according to Johns Hopkins University's tally. Now, the US making up more than a fifth of deaths. Meanwhile, a new book and recording has shown that US President Donald Trump admitted earlier this year that he knew COVID-19 was deadly, but said he wanted to play down the virus to avoid panic. Here's more details on our global update.
The global death toll from the coronavirus has passed 900,000, while the number of confirmed infections is nearing 28 million. The US is still by far the worst hit country, with more than 6.3 million cases and 190,000 deaths, more than a fifth of the total. Brazil is in second place with more than 128,000 deaths, followed by India with over 75,000 people dead. Meanwhile, a forthcoming book reveals that President Donald Trump admitted to intentionally downplaying the dangers of COVID-19 pandemic. The book is named Rage and is written by U.S. veteran investigative journalist Bob Woodward. According to the new book, Trump admitted he knew weeks before the first confirmed U.S. coronavirus death that the virus was dangerous and more deadly than flu, and that he repeatedly played it down publicly. In Asia, Indonesia's capital Jakarta is set to reinstate wide-scale social restrictions because a rise in coronavirus infection threatens to strain its health system. Governor Anies Baswedan says the capital will reinstate restrictions similar to those imposed from April until June, when public transport was limited and dining in restaurants was forbidden. Working from offices will now be prohibited from next Monday. And Peru has stepped up testing a coronavirus vaccine from China's Sinopharm, which researchers say should help the country gain faster access to inoculations once the vaccines are approved. Sinopharm has reportedly recruited up to 6,000 volunteers in Peru, which has the highest number of COVID-19 deaths in relation to its population size. A team of Chinese scientists is in the Andean nation to work with local researchers at Lima's Cayetano Heredia University.
Take a look at our website, channelstv.com. It has the latest update on the pandemic. You can find that story. Over 7,000 health workers killed that have died after being infected with COVID-19. You find Mexico has the largest of that number. There's several other stories there. It's on our website, channelstv.com. That's the program this afternoon. Thank you for watching. I'm Millicent Nwaka. Stay safe.